I've spent more than 30 years on the front lines of emergency medicine, and I need you to really listen. If you're over 60 and you're alone when a heart attack hits, your chances of surviving that first event drop dramatically. This isn't alarmist talk. It's the reality I see every week. Nearly half of fatal heart attacks happen before victims ever reach a hospital. Why? Because time is wasted. People hesitate. They panic. They dismiss warning signs. They don't know the simple, evidence-backed actions that can keep blood flowing long enough for help to arrive. And the brutal truth is this: if you don't know these steps, you could be gone in minutes. Every day I see patients brought into my ER who could have survived if they had done one or two things differently at home. A crushing pressure in the chest, sudden breathlessness, dizziness, a cold sweat by the time many of them arrive, the golden window has slammed shut. But here's the good news. There are straightforward, science-supported actions you can do immediately, even if you're completely alone, that can double your odds of survival. Not gimmicks. Not myths. Real strategies cardiologists teach and emergency teams rely on. In this video, I'll walk you through 7 life-saving tips every senior must know to survive a heart attack when nobody else is around. These are the exact steps I wish every patient who walks into my ER had practiced beforehand. And wait until you hear number 3, it's unbelievably powerful. Research shows it can be the difference between severe permanent damage and walking out of the hospital alive. Most people have no idea, but after today, you will. All medical references and scientific studies I mention will be linked in the description below. Before we dive in, a quick question: how old are you? Tell me in the comments. I personally go through and reply to every single one like it's a clinic conversation, so please be honest. Now, without further ado, let's start with number 7 on our list, the very first step that could decide if you make it out alive. Number 7 tip: no. 7. Call emergency services immediately. Do not wait it out. The single most critical action when you feel the signs of a heart attack is this: call emergency services right now. Do not second guess. Do not tell yourself, maybe it's just indigestion, or I'll see if it passes. Every minute of delay matters. The damage to your heart muscle increases as time goes by. Cardiologists sum it up plainly: time is muscle. The longer blood flow is blocked, the more heart cells die and the lower your chances of walking out of the hospital. The evidence is stark. Patients who call emergency services within the first 5 to 10 minutes of symptoms survival odds dramatically higher than those who delay. Yet tragically, many seniors downplay their symptoms. Studies show nearly 1/3 of people over 60 wait more than 2 hours before seeking help, often because they don't want to bother anyone or they believe they can tough it out. That hesitation can be fatal. Picture this: a 68-year-old grandfather at home felt odd chest pressure one evening. He told himself it would pass, drank water, and sat down to rest. He waited for hours, hoping it would fade. By the time his daughter found him and called 911, irreversible damage had occurred. Doctors told the family that if he'd called at the first symptom, he might have survived with minimal heart damage. Stories like that repeat thousands of times every year, and most are preventable. Recognizing the urgency and making that call is the first act of survival. While you're waiting for paramedics to arrive, what you do next can keep blood moving and buy you precious minutes. That brings us to tip number 6, a simple, powerful, and widely recommended medication many people already have at home. Number 6 tip: no. 6. Take aspirin if available and you're not allergic. Once you've called emergency services, the next move could be life-saving. Take aspirin, but chew it, do not swallow it whole. Aspirin is not just a pain reliever. It's one of the most effective over-the-counter antiplatelet agents available. Most heart attacks occur when a clot forms and blocks blood flow to the heart muscle. Aspirin helps prevent clot growth, keeping some blood moving until advanced care begins. The clinical evidence supports this. Studies and landmark trials show that taking aspirin during an acute coronary event reduces the risk of death. But here's the crucial detail: speed matters. Chewing an aspirin lets it enter the bloodstream far faster than swallowing a whole tablet, which can delay absorption by several minutes. In a situation where every second counts, those minutes can save heart muscle and save your life. I have treated patients who credited a chewed aspirin with reducing the extent of their heart damage. A retired bus driver, 70 years old and alone at home, felt crushing chest pressure, chewed an aspirin while calling 911, and later told us that action likely prevented major heart damage. He walked out of the hospital 2 weeks later and was still independent. Now, if you have an allergy to aspirin, a bleeding disorder, or your doctor has told you specifically not to take it, skip this step. For everyone else, keeping a bottle of regular, non-enteric-coated aspirin in an easy-to-reach place is one of the smartest emergency precautions you can take. Doctors generally recommend a single 325 mg tablet at the first sign of a heart attack. Think of that chewed aspirin as a temporary rescue squad, slowing the clot until professionals can act. It won't cure the attack, but it can stop the damage from spiraling out of control. Acting quickly with aspirin keeps the odds in your favor. But surviving a heart attack alone isn't just about what you take. It's also about how you position your body and manage breathing in those terrifying minutes. That's where tip number 5 becomes crucial. Number 5 tip, no. 5. Loosen tight clothing and sit upright to reduce strain on the heart. When a heart attack strikes, every movement and every posture change affects how hard your heart must work. One of the simplest, most overlooked actions is to remove constrictive clothing and sit upright. Tight belts, waistbands, or collars compress vessels and can make it harder for your body to circulate oxygen-rich blood when it needs it most. Sitting upright, ideally at a slight angle with your back supported, opens the chest, eases pressure on the diaphragm, and improves lung expansion. That makes breathing easier and reduces workload on an already struggling heart. This isn't just common sense, it's grounded in physiology. During cardiac distress, the heart is desperate to pump oxygen through narrowed or blocked arteries. Lying flat forces the heart to work harder, especially in seniors with weaker lungs or pre-existing lung disease. Clinical reviews emphasize that positioning patients upright during acute cardiac events helps reduce pulmonary congestion, the fluid buildup in the lungs that makes breathing feel like suffocation. In plain terms, how you sit can mean the difference between gasping for air and staying calm enough to survive until help arrives. Picture a 74-year-old woman who felt pressure while gardening. Instead of collapsing, she moved to a chair, loosened her apron and waistband, and sat upright while waiting for the ambulance. Her doctor later said that decision likely prevented fainting and collapsing before paramedics could give oxygen. That tiny adjustment kept her heart from collapsing under added strain. It's a step so simple many seniors overlook it. If you feel chest pressure, shortness of breath, or cold sweat, sit upright. Relax your shoulders and free your chest and waist from restriction. Think of it as giving your heart room to breathe. That adjustment buys you stability. To further improve your odds, you also need to maintain blood flow to your brain and heart when circulation is under attack. That brings us to an unusual but sometimes effective physical action. Number 4 tip, no. 4. If you feel faint, cough strongly and rhythmically to help maintain blood flow. It sounds strange, but in the middle of certain cardiac events, forceful coughing repeated every 2 to 3 seconds can temporarily keep you conscious. Clinicians sometimes call this cough CPR. When you cough deeply and forcefully, your chest muscles contract, intrathoracic pressure rises, and blood is forced out of the heart toward the brain. That temporary boost in circulation can preserve consciousness and prevent brain injury for short periods until definitive treatment arrives. This is not a cure, and it is not a replacement for true CPR or emergency intervention, but case reports and clinical observations show it has helped some patients stay awake through severe arrhythmias. Imagine a 69-year-old retired mechanic alone in his workshop who felt dizzy and nearly fainted during a massive heart event. He began coughing forcefully, repeatedly, and stayed conscious until paramedics restarted his heart in the hospital. The coughs likely prevented him from collapsing and suffering brain damage. If you ever feel your vision narrowing, your head spinning, or your body going limp during chest pain, take a deep breath and cough hard as if trying to clear your lungs. Repeat every 2 to 3 seconds until dizziness eases or help arrives. Think of this as a manual, short-term way to keep oxygen moving to your brain and heart when circulation falters. Too many people tell themselves they are being a burden if they call or they confuse mild discomfort with a true emergency. Seniors often present with atypical symptoms, jaw or arm pain, unexplained fatigue, nausea or indigestion, lightheadedness, or faintness without classic crushing chest pain. Because the presentation can be subtle, be crystal clear if something feels off and it is new, sudden, or worse than usual. Treat it like a heart attack until proven otherwise. That single decision to act fast will save lives. When you call emergency services, speak clearly and be concise. Tell the dispatcher your location, describe the symptoms. For example, severe chest pressure, shortness of breath, sweating. Say how long the symptoms started, and list any medications you take, especially blood thinners, nitroglycerin, or insulin. If possible, tell them whether you are allergic to aspirin. This helps paramedics prepare the correct equipment and medications en route, shaving off precious minutes. Keep an up-to-date list of medications and conditions on the fridge or in a smartphone note that is easily accessible. Consider wearing a medical ID if you and list any medications you take, especially blood thinners, nitroglycerin, or insulin. If possible, tell them whether you are allergic to aspirin. This helps paramedics prepare the correct equipment and medications en route, shaving off precious minutes. Keep an up-to-date list of medications and conditions on the fridge or in a smartphone note that is easily accessible. Consider wearing a medical ID if you have known heart disease. Keep a bottle of regular aspirin visible and within reach, and review with your clinician whether chewable aspirin is appropriate for you. One critical rule: do not drive yourself to the hospital. Let EMS bring you. Paramedics can begin life-saving treatments, monitor your heart, and alert the hospital to prepare advanced therapy before you arrive. Minutes saved on your couch translate to lives saved later. There's a psychological factor to panic narrows decision-making. If you can, take a breath and run a simple checklist. Call 911, chew aspirin if safe, sit upright and loosen clothing, cough if you feel faint, and make sure your phone and door are accessible. Convert terror into action. Action saves muscle, brain, and life. Remember, the majority of heart attack deaths occur before patients reach definitive care, largely because the window closes quickly. These steps are meant to slow the clock and keep you viable until help arrives. I'll repeat them later in a rapid sequence so you can memorize them, and I'll include printable checklists in the description to place on your fridge or near your aspirin supply. Finally, and this I say from the bottom of decades of ER work, take this personally. I have lost count of how many times I have wished a patient had known one simple thing sooner: a call made 5 minutes earlier, an aspirin chewed, a belt loosened. Those small differences change recoveries. If you learn only one thing from this video, let it be to act fast. Now, with the ambulance on the way and your steps cued, we move to the next life-saving habit you must adopt. Number 3, unlock. Tip no. 3. Your door and keep phone nearby so help can reach you quickly. When a heart attack strikes, every second is precious. Not just for your body, but for the people trying to save you. One of the most overlooked survival steps is also one of the simplest. Unlock your door and keep your phone within arm's reach. It sounds small, but in a crisis, it can mean the difference between being found in time or being trapped behind a locked door while precious minutes slip away. Here's why this matters. First, it increases the amount of oxygen reaching your blood and brain, which are desperate for fuel when circulation is limited. Second, it signals your nervous system to calm down. Research published in the Journal of Cardiopulmonary Rehabilitation and Prevention found that slow, controlled breathing reduced heart rate and improved oxygen delivery, even in patients with advanced cardiovascular disease. It's not a cure, but it gives your body a fighting chance while you wait for help. A 76-year-old retired nurse from Michigan described how she survived her heart attack by focusing only on her breathing. As the crushing pressure in her chest grew, she resisted the urge to panic. She sat upright, closed her eyes, and began inhaling slowly through her nose, exhaling even slower through her mouth. By the time paramedics arrived, she was weak but still conscious. Her cardiologist later told her that those steady breaths likely reduced the workload on her heart and kept oxygen moving to her brain long enough for treatment to begin. Here's how to do it if you ever find yourself alone and in danger. Place a hand on your stomach, not your chest. Inhale deeply through your nose, feeling your belly rise. Then exhale gently through pursed lips as if you're blowing through a straw. Aim for about 6 to 8 breaths per minute, slow, controlled, and deliberate. This kind of diaphragmatic breathing not only helps the heart, but also keeps your mind focused when panic wants to take over. Think of each deep breath as buying yourself more time. Time for oxygen to reach your brain, time for your heart to ease its workload, and time for paramedics to arrive. And if there's one more habit that ties all these survival tips together, it's the last and most critical one. The action at number 1 that research shows can double your odds of survival. Number 1. Stay as calm. Tip no. 1. And still as possible. Movement can worsen damage during an attack. When a heart attack strikes, your first instinct might be to move to pace or even to try and walk it off. But that instinct can be deadly. The number 1 survival rule is this: stay as calm and still as possible. Every step, every sudden movement forces your weakened heart to pump harder. And during a heart attack, your heart is already fighting for its life. By keeping your body still and calm, you reduce the strain, conserve oxygen, and give yourself the best chance of surviving until help arrives. Science explains it clearly. During a heart attack, blood flow through the coronary arteries is blocked or severely reduced. Movement demands more oxygen from the heart muscle. But with its supply cut off, that extra demand only increases damage. A clinical study in the European Heart Journal found that minimizing exertion during acute coronary episodes reduced complications and improved outcomes. In plain terms, seniors who stayed calm and still lived longer than those who moved around in panic. One 71-year-old farmer in Nebraska learned this firsthand. While repairing equipment, he felt crushing pressure in his chest. His first thought was to climb back up the ladder to grab his phone. Instead, he forced himself to stay put and called for help where he was. Paramedics later told him that staying still kept his heart from collapsing under stress. He survived with far less damage than doctors expected. Calmness isn't just physical, it's mental. Panicking floods your body with adrenaline, raising blood pressure and worsening the attack. By focusing on staying still and practicing slow, deep breaths, you lower that hormonal surge and help keep your body stable. Tell yourself, I call for help. My only job now is to stay still and breathe. This mindset prevents rash decisions like trying to walk to the door or grab something across the room. Actions that can trigger collapse before help arrives. Think of your heart during a heart attack like a fragile engine running on fumes. Every movement revs the engine faster and risks blowing it apart. Stillness, calmness, and conserving every ounce of energy is the key to buying time. This is the final, most powerful habit. Do less, breathe more, and let help reach you. Together, these 7 tips form a survival map. And while you can't predict when a heart attack might strike, knowing exactly how to act can be the difference between tragedy and survival. And there you have it. 7 life-saving tips every senior must know to survive a heart attack alone. From calling emergency services right away to shooting aspirin, loosening tight clothing, coughing when faint, unlocking your door, taking slow breaths, and finally staying completely calm and still. Each action buys you precious minutes. Minutes. They can mean the difference between life and death. Remember this, a heart attack doesn't always give you a second chance. But if you act fast, think clearly, and follow these steps, you can survive and live to see tomorrow. The science is clear, but it only works if you're ready to act. Now, I want to hear from you. Where are you watching from? And do you keep aspirin or another emergency plan ready in your home? Drop your answer below. We read and reply to every single comment because your story matters and your survival tips could help someone else. Don't forget to like this video, share it with your loved ones, and subscribe for more life-saving advice. Stay safe, stay prepared, and remember, knowledge is power, especially after 60. If you have any questions or want to share your personal experience, don't hesitate to leave a comment below. We're always listening. Thanks for watching.